Thank you everyone for being here. We're going to commence the program now. If everyone could please take their seats.
Good afternoon everyone, and a very warm welcome to all of you. We are deeply honored to gather here in Geneva for this important event hosted by the Government of Pakistan in collaboration with the Global TBI Coalition to advance the recognition of TBI as a notifiable and chronic condition. I would like to express our sincere gratitude to the NIHR Global Health Research Group on acquired brain and spinal injury at the University of Cambridge, Professor Peter Hutchinson and his team, for their generous support and funding for this event, and for their continued partnership in advancing this agenda globally. I would also like to acknowledge the American Congress of Rehabilitation Medicine for their generous support to sponsor our persons with lived experience, for their donation, and which we are going to hear from our persons with lived experience in a while. Very briefly, the Global TBI Coalition began in 2023 during discussions between Northwest School of Medicine, Pakistan, and the NIHR Global Health Research Group on acquired brain and spinal injury at the University of Cambridge. The shared realization was clear. Traumatic brain injury is not only an acute injury, but a chronic life-altering condition requiring recognition, reporting, rehabilitation, and long-term care. In 2024, this work expanded through collaboration in Canada, the Canadian Traumatic Brain Injury Research Consortium, and the G4 Alliance, which formally announced the Global Working Group on TBI during its Permanent Council meeting in Peshawar in 2024. Today, this momentum has grown substantially, with more than 50 global organizations now endorsing and supporting the call for a World Health Assembly resolution to recognize traumatic brain injury as a notifiable and chronic condition. This broad coalition reflects a shared global commitment to improve surveillance, prevention, rehabilitation, long-term care, and policy accountability for people living with consequences of traumatic brain injury. The Global Coalition for TBI's latest paper, just published in the Lancet Global Health, summarizes the current state of TBI care globally, including existing gaps and opportunities for improvement. This outlines where our efforts to recognize TBI as a notifiable and chronic condition would help improve TBI care access and quality for all. To read it, you have a pin on your course probably. You can scan that pin and you can read the paper and other resources on our website. So now, without any delay, I'll hand over to my colleague Sanya, who is going to introduce our amazing person with lived experience speakers. Thank you.
Hello everyone, and welcome to this event. We all know that ultimately it's people with lived experience and patients themselves who are at the centre of the TBI Coalition's mission, and ultimately and hopefully our impact. So it's a delight to be welcoming Professor Paul Dubetz to the stage, who will be speaking to us about lived experience as evidence, and most importantly about how our PWLE storybook is going to be crucial to shaping policy and advocacy action. Over to you.
Thank you, Sonia. It's a real honor and pleasure for me to be able to give you a perspective from a person with lived experience who has survived TBI. Very briefly, my injury, I give you a little background on it, occurred while I was living and working outside the United States in Milan, Italy. And I remember well in February of 2010 leaving the office to go home for dinner. I didn't get home for dinner because I was crossing the street and hit by a car. We had a miscommunication, the driver and myself. And that led to an injury, a very severe injury. And I incurred 2 brain surgeries over about a week period of time. I was in a coma for 5.5 weeks. And that's traumatic. But as you can imagine, not just traumatic for me, but my family, who was with me, all they knew is I didn't come home for dinner that evening. And there was a need to find out where Paul might be. And they did. Not with particularly good news to greet them, but at least that I was living, alive, and had undergone some surgeries. After this 5 weeks or so of being in a coma, the next memory I have to leaving the office on that day was being in a bed in Milan, in a hospital, and interestingly, not feeling down by it, but thinking, I'm here, I feel okay, I'm living, and something has happened. And I'm going to learn what that is and what effect that can have on me. And I think that mindset is a critical tool to recovery. The mindset, the positive thinking, let's say it, not just for the person who incurs the injury, but also for those caregivers who have the responsibility in dealing with it. And so I remark my recovery happened to be a very positive experience. I did recover well, and I was back at work after this incident 6 months later, which is extraordinary in many regards. But it's an example of what can happen. The mindset is a key part of it, as is the care being given. But that is just my story, and it's one of many that happen. As we are all well aware, TBI is a global issue, very much so. And that's why we're at the WHO taking the initiative we are with the help of many who have an interest in it. And to help messaging that, we have created a storybook, which is a collection of testimonials like mine, but very unlike mine in many respects. And the key objective of that book, which is available to you on the site using your badge if you wish, is to show and demonstrate how this is a global issue that we are dealing with. And we have testimonials from around the world, from 6 different continents. But not only that, the diversity of causes of TBI also should be illustrated, because they're all unique in many respects. And so we have in our book testimonials coming from traffic accidents like myself, being in a conflict zone, which is a common ailment, sports injuries, which is increasingly common as we're seeing, domestic violence, clearly an issue associated with it. We want to capture all of those, and told not from some professional perspective of a medical professional, which is important messaging, but from the heart of the individuals themselves who have suffered or who have experienced it. And these testimonials come not just from people who incur the injury, but also from caregivers, because that's part of the tool as well. I'll leave it at that. I'll pass it on to the next individual we have here to speak. Thank you.
Thank you, everyone. I would like to invite our next speaker. Continuing on the theme of lived experiences, we would like to invite Mandy up to the stage. Mandy is a nurse practitioner, and she has had many awards over her career, but in 2023 she suffered a traumatic brain injury herself, and since then she's been able to merge her own experience and what she's learned in her career to give personalized care for TBI. So thank you very much.
Thank you again. So my name is Mandy. In the United States, I work as a nurse practitioner, and for those outside of the United States, in the United States, I practice very much like a physician. I have been working in neurosciences since 2000, so almost 26 years now. I thought I knew a lot about taking care of patients that had traumatic brain injury. I worked in the hospital. That's all I did, was take care of patients that were hospitalized with any kind of neurological ailment, including traumatic brain injury. And I thought I was giving really, really good care until, as she mentioned, in 2023, I was in my own car accident. And from that car accident, I had several issues that I wasn't aware of. I knew that I had a really bad headache, and that's about all that I was aware of initially. Over the next weeks to months, I developed issues with my balance, with my vision, with my ability to speak, my ability to understand speech. I would not be able to give this kind of speech like I'm doing right now because I would lose my train of thought in the middle of a sentence. Couldn't remember my medical knowledge at all. That knowledge was not accessible to me. So trying to get back to work was not an option for quite a bit of time. And it was very frustrating to me because I didn't realize that I had all the issues that I did. My husband and I were in the car accident, and like Paul was saying, we were trying to get to dinner as well. We were going out to dinner that night, never got to dinner. And life was very different after that point. It took me almost 2 years to get back to work. And it wasn't in the hospital setting where I was previously, because it was too loud, too bright, too busy, too many people talking at the same time, and I couldn't understand what people were saying, much less be able to respond to them. So in those 2 years, I had to decide what I wanted to do when I grew up. I kind of joked about that for a long time. What am I going to do now? Because I didn't know if there was ever going to be a time that I got back to work because I was so affected by my brain injury. And again, I just had a headache. I didn't realize what else was going to go on at that point. 2 years later, I got back to work 2 days a week for 6 hours a day. So 2 days a week after 2 years. There's the number 2 a lot in there. It took me another year to get back to 4 days a week, where I am now. But in that process, I learned so much more as a patient than I ever did in any of my schooling, lots of years of school to become a nurse practitioner. And it was all based on that experience as a patient that transformed my practice now. I have a podcast that started before my accident, talked about all things related to brain health and wellness, and now it's all brain injury because I've learned so much that I feel like I need to share that information. And my practice is very different. It's not just based on the traditional things that we were taught in nursing and medical school, because there's so much more that can help people. And I've connected with people around the world because, again, this is a global issue. It is not just something that affects Americans or Canadians, New Zealand, anywhere, any country that we represent. It does not affect any gender, any race. It can affect anyone at any time. And I have patients from around the world that have come to see me, not necessarily from this far away, but I have patients come from several hours because I have that experience. And when they look and they see that I've been through it myself, they understand that I'm probably going to understand what they have been through a little bit more. And I wish that I could convey that to everybody without having to have all of you go through the same kind of experience, because there is so much more that we can do for brain injury, and I'm excited to see what comes out of this group and what moves forward in all there is to see in brain injury. I tell people right now is a really good time to be in brain injury because there's so much momentum and there's so much excitement and there's so many things changing at all times. So hey, thank you for listening. I hope that you can understand things a little bit better from the patient's perspective.
Thank you very much, Mandy. Next, I would just like to invite Professor Fefiko Santinido, who's the president of the American Congress of Rehabilitation Medicine, to say a few words, please.
Hi. Congratulations for organizing this wonderful event. The American Congress of Rehabilitation Medicine has about 103 years history. It is a unique organization that consists of professionals from different disciplines from medicine, different specialties of medicine, and neurorehabilitation, including occupational therapy, physical therapy, speech-language pathology, psychologists. We have scientists, neuroscientists, bioengineers. So it is truly an interdisciplinary organization with the mission to improve the lives of those with disabling conditions through advocacy, through research, and contribute so that anyone can live the best life they can live. And so when we heard about this global initiative, we wanted to be part of the discussion. We have groups specializing in brain injury at ACRM, and it has been one of the main focuses for over 50 years of the organization. So we want to be an ally in our efforts to promote the better understanding and also making TBI a priority in the healthcare systems. So congratulations for organizing the event, and we really look forward to collaborating with all of you. Thank you.
Thank you very much. Our next panel will be moderated by Professor Richard Moser. If all the panelists could please come up as well.
Good afternoon, everyone. The goal of this panel is to look at the burden of traumatic brain injury and the rationale for why the resolution for making it a notifiable and chronic disease needs to occur. So we have a wonderful, distinguished panel. To my immediate right is Angela Colantino, who is a professor at the University of Toronto and is running or director of a program for the traumatic brain injury, the Canadian Research Chair for the Traumatic Brain Injury Program. Next is Alexis Geneva, who is a neurosurgeon and is at the Addenbrooke Hospital, and is also a deputy director of a program designed to develop new technologies for the brain injured patients. And the third panelist is Bernice Goulet, who is a acute care and advanced practice nurse at the University of Washington, who has spent her career in dealing with traumatic brain injuries. So I would like to first of all present the initial question, which is, why is now the time to pursue the resolution for traumatic brain injury as a notifiable and chronic condition? So why is it now that we need to do this?
Thank you for that introduction. Well, we all know that the numbers are staggering with respect to traumatic brain injury, with 69 million people affected annually. And these do not include many people not captured in our surveillance systems, such as persons who are homeless, persons who are incarcerated, persons who are affected by violence, including intimate partner violence, who do not seek care at time of injury. And so also the economic consequences of the injury are huge. And also, I think it's really fantastic that we have the support of persons with lived experience and endorsement by them for this initiative. And I'm truly impressed with the coordination that is inclusive in this initiative.
From my perspective, I see it as an evolution of events. So we've gone a long way, and the testament to the fact we have this session, so we understand the impact. So we understand the impact of TBI at an individual level, and this is something that 5-10 years ago was less so. But now I think we're in a position that we need to understand what is the true scale of this. And we have reached a stage now that we understand it at a personal level. We have systems that can collect data in a cost-effective manner, in a scalable manner, and also having the right governance and security framework. So now we have you could say, the opportune time from both a technical and a willingness perspective, from a global collaborative perspective, that we can then say, well, the only way to then truly appreciate the scale of the problem is to make this a notifiable condition, because only then we will be able to both appreciate the scale, but also be able to act upon it, both in terms of health service planning and provision, but as well as influencing policy. And without knowing the true scale of the problem, we'll always be limited in how much we take this into account.
Thank you. I do echo the both of the panelists and the panel that I think when we look at the TBI is we know that has been a big problem for a long time, and I think everyone actually been doing the things that you try to help the patients in a way that they can on their settings. I think what we're missing is the coordination of these care that the patient receive in clinical arenas. How do we get patient from pre-admission all the way to the rehabilitation? How do we create this the continuum of the care of this patient that we can follow, and also they do receive what they deserve to receive. And I think we heard from today both of our person with lived experience that told us that patient when they leave hospital, the things that doesn't end there. So we know that there is the thing that we have to do as we have gained this global momentum that we've been working on. That we hope that we will achieve this the continuum of care through our efforts.
Thank you. We have a painfully short time to discuss this topic, but I do have a specific question for Angela. I would like to ask her from a rehabilitation and a long-term care, why do we need to see traumatic brain injury as a chronic condition, not just an acute insult?
Thank you. Well, traumatic brain injury can result in long-term cognitive, physical, emotional, and behavioral sequelae. Also, it impacts community integration, such as participation in work and education. It affects social integration, and it has a major impact on families. And as such, it also is a risk factor for conditions such as dementia, neurodegeneration. And it's an invisible disability, and also there's stigma attached, which has affected awareness and support overall. And as we continue to make advances in acute care, more and more people are surviving this injury, and quality of life is therefore paramount. And that is the natural domain of rehabilitation, and is why it's being called a key health strategy of the 21st century. In 2019, it's been estimated that 49 million people worldwide were in potential need of rehabilitation. And it's been documented that most of that need has been unmet. At least 60% of persons in lower and middle income countries, with much more lower percentages than that, higher percentage than that in many parts of the world. The good news is that we do have effective multidisciplinary rehabilitation interventions. It's included in brain injury rehabilitation is included in the package of interventions for rehabilitation put out by the WHO. And it's in alignment too with the newly passed World Health Resolution on strengthening rehabilitation in health systems, which calls for rehabilitation to be integrated across healthcare systems. And it also integrates accountability in terms of looking at measures such as function, resource allocation, and in addition to important indicators such as mortality and morbidity.
To follow up on that, Bernice, could you talk about, from the perspective of a health system, what do we lose when we don't have a systemic measurement of the magnitude of TBI as a clinical problem?
Thank you for the question, Dr. Moser. I think this really goes to the very heart of why we are here today. When we look at it from a clinical health system perspective, when the TBI is not systematically tracked or reported, the first consequence is that the patient becomes invisible. And we may capture the ER visits, CT scans, admissions to the ICU, and maybe surgical interventions. But often they lose sight of overall picture and what happens after discharge. And was the patient able to receive follow-up care, whether the symptoms persisted, whether the rehabilitation was available to the patients. And when we look from the emergency settings, the absence of surveillance means that we are operating on a big data map and a population level data that not available to us to provide the care to the patients. And if you don't know where the injury is occurring, who's most affected, and what mechanisms that are common, and which patients are returning with complications, and it becomes difficult to strengthen prevention, triage, and acute care pathways. And data really helps the emergency systems to understand the patterns and plan accordingly of the needs of the patients. And as a clinicians, we all see the human side of the gaps. The patient we see who survived injury, but unable to go back to return to work, school or family life, or their community participation. And so the goal should not simply be to discharge patients to home, but be able to build systems that follow the support and to recover through admission all the way to the rehabilitation with dignity. So that requires clinical leadership and public partnership and national commitment. So I think when we say that the data is really not just a technical issue, it is a clinical safety, rehabilitation, workforce development, as well as equity and access issue. And this sort of stronger notification and surveillance systems will really help countries move from TBI as a single event to a truly or recognize a condition that requires prevention to long-term support. And that is where the WHA resolution can really help the countries build a system that can provide the comprehensive care to its citizens.
Thank you. We will have a question and answer period, and anyone who has questions, and we encourage questions, there's a podium in the back with a microphone that you could start to line up for questions that you might have. Our last question is to Alexis, and this has to do with the need for global registries to document the magnitude of traumatic brain injury. As the foundation, you can't change what you don't measure. So could you please speak to the issue of registry and the need?
I mean, the importance of systematic data collection, Bernice has very eloquently laid out. When we started, our registry work 9 years ago, one of the first things and challenges we recognized was we need to be able to have a way to collaborate across different systems, across different countries. And so what we've done over the last few years, we've done a number of snapshot pieces of work. For example, one study, GENOS, looking at just surgical interventions with anonymized data across 57 countries, 1,700 patients. A more ambitious project then saying, well, what about the people that don't need surgery? So that was the foundation for the broader GeoTBI registry. We've now just exceeded last month 3,000 patients. We've now 27 countries up and running. One of the big challenges there was having a governance framework that will allow for ongoing data collection, because it's not just the acute event, as Angela has shown. We need to be able to track outcomes over time. So for that, you need to be able to look at an individual patient and make sure that we have the appropriate legal framework to do that. And then, of course, what about a lower threshold? If you want a real sense of the scale, then you need to look at just lower resolution data at much larger scale. And this is where the Notifiable project, which has been spearheaded by Tariq and his team in Pakistan, which is within a short time, more than 180 patients. So we've looked at different perspectives to collect data successfully across different centers, across different settings. But now we need to say, how do we make that systematic? So we need to have some uniform approach to say, well, if we are looking at things over time, we can see the trends, we can see the effectiveness of our policy. of our new interventions. So now we have the building blocks on how to do that successfully and affordably, because of course, not just something that works for high-income countries, but something that works for low and middle-income countries. We've shown that it can work effectively. We can collaborate with 60, 70 countries to do that. And registries are very powerful, but I've worked with about 10 registries over the last 15 years. And probably the most important take-home message is less is more. You need to be able to do something that you can sustain for many years and not just a snapshot study. So I think within the context of TBI, you need to move away from a convenient sample over a short time period to a long-term commitment to track what is feasible for many years to come, because only then will you truly unlock the power of data over time to make an impact on our understanding and management of the condition.
Thank you. We have time for a question or two, so we have a person ready to ask a question.
I'll have mine one.
Please identify yourself.
I'll have mine of the One Goal Initiative for Governance. So, how long should a condition have impact for it to be, chronic? And also, it seems that there are lots of things that happen, once, but that change the course of the health of a person, even just any, random infection for which they get antibiotic or some treatment, this has, side effects, and that leads to another thing, which leads to another thing, and, what is not chronic? I guess that's my question.
Well, I think you raised a really important point that the condition can vary over time, and there are ups and downs, and that's why chronic monitoring is important, particularly for moderate to severe injuries. People have said 6 months, 1 year outcomes, but truly people do need to follow up over time if the symptoms have not resolved.
I think when we think about the chronicity of the TBI, it's really comes to every individual is different, and recovery trajectory will be different for each person. Even you may have just a mild TBI. Again, you look like a person is normal and looking normal, but again, as we heard from Mandy, she said, I only had a headache. So, but then somebody who's around her probably noticed the things are that there is more to it. So I think as chronic is really the way that you not able to live your life anymore. I think it is that you're still looking for a way of trying to make it so that you can live your life fully. I think this is what we're kind of talk about when something is chronic. I think again, there's no line. We won't able to give you an exact date. This is the date because again, brain injury is a very I think different in compared to other disease states. So I think it's really go with the individual person. People can take time to up to 20 years to still be recovering from their brain injuries.
Thank you. My apologies for those standing, but I'm getting all sorts of messages that we have used up all of our time. So we're going to move on to the next panel, which will be Marianne Malik from the, let's see, Marianne, we can. Mariam is the WHO director in Pakistan for non-communicable diseases.
Thank you. Good evening, ladies and gentlemen, and absolute pleasure to moderate this session on why we need a WHO resolution for traumatic brain injury. And the reason is simple. The statistics are staggering. Every 1.5 seconds, someone in the world sustains a traumatic brain injury. and millions more continue to live with its consequences. But yet, it is largely invisible in our national statistics. But the impact is painfully visible in the lives of individuals, families, and communities. The socioeconomic cost, if you see, of TBI is immense, but the human cost is immeasurable. And what we have seen is that burden is highest where the systems are weakest. And TBI, it does exposes the fault lines in our health system. So the question before us today is not whether TBI needs a global focus or attention, but whether the global public health community can afford to overlook it continuously. So our today's discussion will highlight TBI as a major public health priority, and we'll examine the linkages with the existing trauma care system, road safety measures, surgical, non-surgical capacities, health equity, rehabilitation, and most importantly, the need to have a coordinated global policy action. I would now like to invite our esteemed panelists, but before that, I would like to say that we are deeply honored by the presence of Excellencies, the Health Ministers, the dignitaries, and delegates from our member states. And your presence here today, it reflects the growing global commitment for TBI. And I would also like to say we are highly privileged to have WHO Regional Director, Dr. Hanan Balki. She has inspired the region because of her commitment, her dedication and vision, and her presence today, it reflects the WHO's strong commitment and leadership for this major but neglected public health issue. So now I would like to invite our distinguished panelist, Nicoline Chaz. She is representing Brain Health Unit, WHO Headquarters, Geneva. Gail Rossio, she is the chairperson for Board of Directors, G4 Alliance. Franco Sarvaldi, he is representing the World Forum for Neurosurgery. So thank you all for joining us today, and perhaps I will begin with my future colleague, Nicoline. So TBI is often described as a silent epidemic because the cases and the consequences, they remain invisible in the health system. So why does WHO consider it important to recognize TBI as a public health priority, and what actions are necessary for strengthening the data system, prevention efforts, and integration within broader priorities such as brain health, NCDs, road safety, rehabilitation, and universal health coverage?
Thank you very much, Miriam, for that question. I just would like to first say thank you to the coalition and to the government of Pakistan for the invitation to be here on this very important topic. And I'm a neurologist, first and foremost. I work in what was previously known as the Brain Health Unit, and it is now a Neurological, Sensory, and Oral Conditions Unit. Brain injury is a very personal topic for me, and I really am very glad that this movement is gaining momentum. So on the eve of the WHA, it's a privilege to be here with member states, colleagues, collaborators, and most importantly, with people who have that shared experience of traumatic brain injury. And so we've already covered the global burden of TBI, but I would like to further highlight that the vast majority of people who have TBI injuries are living in low and middle income countries where the ability and the infrastructure to treat these conditions is the most limited and the most scarce. And so traditionally, TBI has been considered an acute, isolated event. And there was a question earlier about what is a chronic TBI. But there's very little data following those people, but after they present to the emergency room and onward, there's very little data finding out what happens to these people, what kind of services do they have, what kind of interventions do they have, in order to regain a meaningful life as well. So I want to just share a little bit about what WHO is doing and how we are incorporating TBI into our work. We cover TBI in a lot of different WHO mandates and a lot of different WHO action plans, crossing the threshold from prevention to acute care to rehabilitation. And so, for example, prevention strategies that we're using are the Decade Action for Road Safety, where we are enforcing helmet and seatbelt laws and trying to decrease the number of fatalities and morbidity that happens with road traffic accidents. We have also partnered with FIFA to try and call attention to sports injuries and concussions. For acute emergency care, I would like to highlight the work that my emergencies colleagues are doing in the ACAN network. ACAN stands for Acute Care Action Network. This is 90 different organizations who are brought together to try and improve acute, critical, and operative care in low and middle income countries. And if there are organizations here tonight, I would highly recommend that you join the ACAN network to try and further increase the visibility of TBI within that coalition. So I'm always very happy to answer more questions on that. Finally, for long-term complications and the sequelae of TBI, the Neurology Action Plan, the WHO Neurology Action Plan is a global action plan that I was personally involved in drafting, for which I'm very proud, and it covers the diagnosis, treatment, and care of neurological conditions, including TBI. Finally, this has already been mentioned, but our rehabilitation colleagues have done a lot of work in their package of interventions for rehabilitation. They have a specific chapter on spinal cord injury and TBI, and so that is actively being implemented in countries currently. So I can go on and on because I'm very enthusiastic about this topic. So thank you very much.
Thank you, Nicolene, for highlighting the critical role of WHO in addressing this issue, and also the need for greater visibility of TBI in our surveillance systems, in prevention strategies, and also broader global public priorities. So building on that, I would now ask Gail the perspective of G4 Alliance. The timely access to trauma and neurosurgical care, it makes a difference. We talk about early recovery, disability, and death from an otherwise preventable and treatable injuries. So from the standpoint of G4 Alliance and the global surgery community, why should TBI be understood as part of the broader agenda for surgical, trauma, emergencies, anesthesia, and rehabilitation care?
Thank you very much, Miriam, and I want to also echo what you said, Nicolene, welcoming everyone who is here and thanking you for being here and recognizing something that is really near and dear to my heart. As a neurosurgeon, this is something that I have dealt with all of my life, but I think it's touched all of our lives. So when I think about the impact of TBI, I think about three things. I think about the scope, the shock, and the soul. So in terms of the scope, TBI is responsible for the largest number of human traumatic deaths on the planet. 6 million a year. It's like the United States having our own pandemic death level from COVID every year, year after year after year. The numbers, the scope are astounding, and the numbers of people who are left with disabilities as a result of surviving a TBI are much higher, on the order of 20 million people living with the effects of a TBI every year. So the scope is enormous, and that alone should make us all care about it. Then you think about the shock of it. By definition, it's traumatic at the start, and it's something, therefore, that affects individuals, families, and communities in a way that absolutely uproots them, and we should care about that. And then finally, soul. I believe, I think many of us do, that our brain is our humanity. It what makes us us, and what makes individual humans the wonderful persons that we are, and therefore we must care about it. So if you put that all together, what more important goal could we have than to prevent, protect, and rehabilitate the brain, which makes us who we are.
Yes, thank you, Bill. Because I think you have highlighted very importantly, because TBI, it cannot be addressed in isolation. We need to have a coordinated and integrated approach, and especially in low middle income countries where the burden is highest. So against that backdrop, I would now like to ask Franco, when we see the outcome of TBI, it is often shaped by disparities in workforce, infrastructure, emergency responses, and rehabilitation services. So from a global neurosurgery and World Forum of Neurosurgery perspective, what are the inequities in TBI care and what a WHO resolution could help address?
Thank you. Not to repeat what my colleague said already very well said, I tell you, I have white hair. 30 years ago, not 200, 30 years ago, neurosurgery was considered a luxury all over the world. Treatment of traumatic brain injuries, most part of the world, was considered impossible because of absence of pre-hospital care. When we did the first round of the guidelines for traumatic brain injury together with our American colleagues, the question was exactly this: should we say something about a part of the world with limited resources? No, because they don't have pre-hospital care, they cannot. When I became the president of the World Federation and started extensive travel, and we did a survey, there is no neurosurgeon in the world. We are 56,000 who is not able to operate a brain injury. All neurosurgeons are taking care of brain injury. We did a survey which was answered by many African and Southeast Asian neurosurgeons, which is your activities. The only activity which was present all over the world is treatment of traumatic brain injury, in spite of difficulties still existing, disparities, difficulties in pre-hospital care, in many countries almost absence of neurorehabilitation. But the neurosurgeons and many others started to work together. You go around the world and you see many experiences, even in countries with limited facilities, of combining efforts, pre-hospital, in-hospital, post-care. And this is a sign that this is not only one disease, it's a disease for many people. And it's a disease where we don't cure only the patient, as the first presentation said, we cure the caregivers, because the disease is reflected to the caregivers immediately, and the discomfort of the caregivers is very high. So this is a bit of scenario.
Thank you, Franco. So in the interest of time, I think we will open the floor for questions from the audience. Anyone who has a question, please, you can come to the podium and ask the question. So while we wait for an intervention from the audience, just one cross-panel question. What single core message you want to give to member states who are going to support or co-sponsor this resolution on traumatic brain injury?
For me, it's changing the mindset from TBI as an acute and isolated condition to a chronic and reportable condition. I think just that mindset change, that this is not an acute event that the patient moves on from. They never move on from this. And so I think that's sort of a mindset change that needs to happen within countries.
Thank you, Miriam. And I'd like to leave two, if I may, core messages to member states. The first one concerning the TBI resolution is really fairly simple. If you care about people, then you care about their brains, and if you care about their brains, then you want to protect them. And it takes resources to do that. I think it's pretty straightforward and pretty simple, and we need data in order to correctly adjust where resources are allocated, where they can do the most good. So regarding the TBI, that would be my recommendation. But going beyond that, since we have member states, what would be the core message to the member states about WHO in particular? I would say, echoing what Franco just said, we need to have a focus on surgery. The days of surgery being too expensive or a luxury that can't be afforded are beyond us, and we should not be thinking that way. Surgery is an indivisible and indispensable part of united access to health care, and we need that.
Thank you so much.
Well, very little more to say. I think combining different countries with the same target and countries with different scenario behind them is we started to do exchanges of our trainees with Pakistan, and we have done it before with Indonesia, and we are doing now with Africa as well. And there is a mutual learning. So they both, on both sides, they learn how to work, how to combine experience, and I think having many countries to support TBI is a reflection of the fact that TBI is different in different countries, but we need to work together. The target is the same.
Yes, thank you. Thank you for highlighting the critical role of member states in elevating TBI at the global health agenda. So we have one question, please. Yes, please.
Thank you for having me again. My question is one of categorization. Is it?
You can't hear.
Sorry. Can you hear me now? There. The microphones at the UN are a bit different. So, is it a disability that we land in, or is it a healthcare issue that is not a disability issue? How do we separate, or do we separate? What does that mean for policy? So, when we say TBI, we land in a chronic condition. Would we be able to say that this is or should we say that this is, the person is then disabled, or is a person with disability? Or is it purely healthcare? Or do we differentiate? Should we differentiate? What does that mean for policy?
I think what she meant is that how to differentiate between a person who's having a disability due to TBI. It is just going to be a disability, or it's talking about the healthcare. So how policy intervention can address both the things.
So I think that the answer lies in the answer that you received from the previous panel. So the severity of TBI and the process of recovery in an individual patient is very, very variable. And whether or not they fall into the classification of disabled or whether they recover almost completely and fully, I think is a very individual journey for the patient. And so I don't think that there's a hard and fast rule as to whether or not you fall into a classification of disability versus not disabled.
So thank you so much. I think one message is very clear, that TBI cannot remain invisible in our health systems, in our financial priorities, and also policy agendas. So with this, we come to an end of this session. Over to Almaz for the next session. Thank you all, and thank you so much.
a great honor to introduce Dr. Hanan Balfi, the Regional Director, World Health Organization, Eastern Mediterranean region. Dr. Balfi was appointed WHO Regional Director for the Eastern Mediterranean by the WHO Executive Board in January 2024 and took up her appointment on February 1, 2024 for a 5-year term. She's also the first woman to serve as WHO Regional Director for the Eastern Mediterranean region. Before assuming this role, Dr. Balfi served as WHO Assistant Director General for Antimicrobial Resistance at WHO headquarters. She has had a distinguished career in medicine, public health, infection prevention and control, and health-related research, with extensive leadership experience in national, regional, and international levels. Her leadership is especially important for our discussion today. The Eastern Mediterranean region includes countries with strong health systems, but also settings affected by fragility, conflict, displacement, humanitarian crises, and resource limitations. Dr. Balfi has emphasized that humanitarian crises are at their core health crises, and that achieving health for all requires resilient health systems, evidence-informed action, partnerships, and solidarity. We are deeply honored by her presence today and grateful for her leadership. Please join me in warmly welcome Dr. Hanan Balfi for her keynote address.
Great, good afternoon, good evening. It's been a marathon, I guess, for everybody. It's really nice that we're here on this very important topic. And before I give my speech, I was just very impressed with the discussion in the previous session, being a clinician myself and having to deal with patients for over 20, 25 years, but infection control, which allowed me to span between pediatrics and adult patients. Dealing with patients with TBI, traumatic brain injury, has been something that is very difficult to manage. So I would like to salute all the doctors, the physicians, the nurses, the physiotherapists, the caregivers, and just to let you know that, and I will mention it in my speech, I took office right in the middle or the very beginning of or a few months after October 23. And it has been very difficult and I was in Gaza actually in July 2024, and it was very difficult to see the situation there, and we had to talk a lot about assistive technologies because they had suffered from the largest number of amputees. But I think this meeting also allows me to think more about how do we engage with them more on TBI issues, which I'm pretty sure they have a lot of. Your Excellencies, distinguished colleagues and partners, traumatic brain injury is one of the most significant yet overlooked public health challenges in our time. An estimated 69 million people sustain a TBI every year, yet it remains under-recognized in many health systems and policy frameworks. Too often, it is treated as a single acute event, as you have heard, rather than a condition with potentially lifelong consequences. This is particularly important for the Eastern Mediterranean region. Across our region, countries continue to face conflict, displacement, road traffic injuries, disasters, and repeated humanitarian emergencies. 9 of our 22 member states and territories are affected by fragility, conflict, and violence. In these settings, TBI is a daily reality in emergency rooms, intensive care units, and rehabilitation centers. The current Middle East escalation has further exposed these pressures, with health facilities overwhelmed by trauma cases while coping with damaged infrastructure, shortages of supplies, and disrupted referral pathways. Yet the burden of TBI does not end when a patient leaves the hospital. Many survivors experience long-term neurological, psychological, and social consequences, including increased risk of epilepsy, stroke, dementia, mental health conditions, and loss of independence. Too often, patients disappear from the system once acute care ends. This is the gap we must address, recognizing traumatic brain injury as both a chronic and notifiable condition would represent a major step forward for global health policy and patient care. First, it would improve visibility. Integrating TBI into surveillance systems would strengthen planning, prevention, and investment in trauma, neurosurgical and rehabilitation services. Second, it would strengthen continuity of care by encouraging integrated pathways that extend beyond acute stabilization to rehabilitation, mental health support, and long-term follow-up. Third, it would strengthen prevention. Many TBIs are preventable through stronger road safety measures, helmet use, safer infrastructure, effective emergency response systems, and more than anything else, peace around the world. In our region, WHO has already taken important steps in this area. At the 71st session of the Regional Committee, member states endorsed an operational framework for trauma in humanitarian settings aligned with the WHA 76.2. Through the Regional Trauma Initiative established in 2020, WHO has supported trauma responses and strengthened frontline clinical capacity across conflict-affected settings. So this proposed resolution offers an opportunity to build a more comprehensive global approach linking prevention, emergency care, rehabilitation, surveillance, and long-term support. WHO and myself personally will remain committed to supporting member states and partners in advancing this agenda, and I take big pride that it is coming from my region, the Eastern Mediterranean region. Thank you very much.
We have our next panel, and if we could please invite the moderators.
Can I now request Professor Hutchinson and Quality Guys to be here for the next panel?
Hello everybody, welcome to this is our first high-level ministerial panel on national leadership and global commitment to traumatic brain injury. This panel aims to explore national perspectives for addressing TBI and commitments to recognising it as a notifiable and chronic condition. My name is Peter Hutchinson, I'm Professor of Neurosurgery at the University of Cambridge, with my colleague Professor Tony Fagati, who's Professor of Neurosurgery in Cape Town, and together we co-direct the NIHR Global Health Research Group on Acquired Brain and Spine Injury. And I would like to take this opportunity to thank our amazing team for all their work in putting this together. So just a quick round of applause, please. So our panel, we have Professor Lemdar, who is the Secretary of State from Cambodia. Please come up. Malik Safi, who's advisor from the Department of Health in Pakistan. Welcome, thank you so much. Minister of Health Banoya from Guatemala. Thank you. And from Tanzania, the Chair of the Parliamentary Committee of Health, Johannes Lukume. And finally, from Italy, representing Europe, Professor Franco Servade, who is representing Italy as the past president of the Italian Society of Neurosurgeons. Welcome, Franco. We're going to kick off with Franco. Franco, you come in the middle. That's okay, thank you. Franco's going to start with a message from the Secretary of State for Health from Italy. So, Franco.
Sorry, I had to change my hat, and being one of the few Italians, I have to represent my ministry. So this is very quickly. The endorsement of global event on traumatic brain injury. Dear Dr. Khan, I wish to express my sincere gratitude for invitation to the event Traumatic Brain Injury as a Notifiable Condition to be held in Geneva. Due to other commitments, I regret they will be unable to attend in person. Nevertheless, I would like to convey my strong endorsement to this initiative and of the coordinated international effort to advance the recognition of traumatic brain injury as a notifiable and chronic condition with the WHO Global Health Our hope is that this important initiative will contribute to the formal recognition of TBI as a notifiable condition, therefore catalyzing stronger and more coordinated national and international response. Please accept my best wishes for a full success of Geneva event and for the prompt and effective advancement of the proposed resolution of the World Health Assembly. Massimo Miscusi, for the Minister of Health and University Research, Italian Republic.
So thank you. We are going to start this different panel that reflects, and first thank you to all the excellencies here representing their ministries of health, recognizing that however hard we work in the clinical services, there will be a massive limitation to what we are able to achieve. There are two major limitations to the work that we can do, and some of that has already been identified. First, for decades now we've been talking about TBI as a forgotten or silent epidemic. And one of the major reasons is that we can't quantify it across the world. So very much unlike what we do in TB, HIV, and other infectious diseases, we can quantify that. In TBI, even though we know that the numbers are more overwhelming, we can't quantify those numbers. And even worse, we're not even close to quantifying what the economic burden is on a country. That's the one problem that we face. The second problem that we face is that there are many stakeholders. So the one stakeholder, which is well represented here, are the clinical services. So we can work very hard at doing a better clinical service, and we need to do better. The second stakeholder are the rehabilitation services, also reasonably well represented here. We need to do a better job looking after patients in the long run. But the biggest stakeholders are those that can work with us to try to prevent traumatic brain injury. Because obviously a TBI that never happened is always going to be better than a TBI that has happened, regardless of how good we are at taking care of those patients. And me in particular, I work with children. So a disability in a child, apart from the devastation that it has for the child and the family, has a massive economic burden on our governments over the several decades of that child's life. So the preventative angle is critically important, but we do not have the familiarity with the systems that can help us do a better job. And because TBI happens in road traffic accidents, interpersonal violence, in either international conflicts or domestic, and falls in sports, there are so many intersections with what government does on a daily basis. So the first question, that is the long preamble to the first question, is your familiarity with how governments work in your particular circumstance and maybe governments across the world. What are the things that you think that governments, A, your governments have been doing to try to reduce the burden, and B, help us in addressing the burden on the clinical services? But most importantly, what are the things that you can anticipate you at a governmental level can do better? Maybe we'll start with the minister from Guatemala.
Well, thank you very much for the invitation. Certainly the lack of data is probably the number one hurdle we face. And this is not only for TBI, but in general, particularly in LMICs. The lack of data is one of the largest limitations to do evidence-based public health. So definitely we need data, but also I think we also need to ask what data, who's going to collect that data, and how are we going to use that data? All of this, so several of these things we have mentioned several times, policies, and policies go beyond Ministry of Health. It involves Congress. And I think in that regard, we also need to recognize that some of this, and I can speak for Guatemala, there's dysfunction. You don't want to go to Congress, and the political process within Congress is very different from what happens within the Ministry of Health. Number one. Number two, thus far, I think the issue has been very medicalized in a sense that it has been looked in a very vertical way, saying this is a public health problem, a healthcare problem. Yes, better access to care, both pre, post, during the event, and then after the event is very important. But this has to be seen as a state problem, where the Ministry of Economics has to be done, the Ministry of Development has to be involved. Who's gonna pay for it? There's no free healthcare. Somebody's gonna pay for it, either the social security system, the public healthcare system, or out-of-pocket expenses, but somebody has to pay for it. And that's where the Ministry of Economics comes in. You briefly mentioned about the prevention part of it. Why is this happening, and why are LMICs carrying the largest burden of TBIs? Well, probably it's a result of poor unplanned urbanization process. So I think we need to step back a little bit. Yes, this is a healthcare problem, but it needs to be recognized as a state issue. And I think that's where the resolution would come in hand, that would raise the level to make it a government, state, a nationwide problem. Thank you.
Thank you very much, Honorable Minister and distinguished guests. I would like to share the experience from Ministry of Health of Cambodia. As one of the low and middle income country, we have a lot of challenge with the TBI problem in Cambodia. As the previous honorable speaker mentioned about the impact of the TBI on the healthcare infrastructure, and in Cambodia, even we have not much resource, and also the human resource and financial resource, but our government and ministry have react to take care of the TBI patient, and from prevention to improve the emergency referral care, and also in education and training of the human resource, and also at the level of the government, we create the committee that participate from the Ministry of Health, of Transport, and inferior ministry for the enforcement of the law, traffic law, and from Ministry of Health, now we are taking a lot of measure to improve the quality of care in Cambodia. From the perspective of the Cambodia, Ministry of Health of Cambodia, I think this global movement is very interesting, and as one of the member states of the WHO, we support and for this global movement, and for the resolution for the WHO to adopt globally to support. As you know, that not only in the developed country, in developed country you have many possibility of human resource and facility, but in the low and middle income country, we lack a lot of resource. So as Cambodia, we need the help from the partner to improve our system, healthcare system, not only in TBI, but in traumatic injury, in emergency, from everything. Thank you very much.
I'm Dr. Safi, and coming from Pakistan. So why we are interested in TBI and why the resolution has been requested in collaboration with all partners across the globe. So we just heard Dr. Anand Balki stating that it's a regional priority, but within the region, having a population of almost 79% under 40 years of age on the roads, working in agriculture and other areas. So significant challenges we are facing, our health systems are facing, though very elaborate at tertiary, secondary and primary care, but definitely managing such a huge population and almost 6% of burden of disease is coming from these injuries. This is a bit of underrepresented data because private sector data we are still struggling to get, and the data we are stating is from the public sector and from the research work which is going on. So keeping these things in mind, and being a member of low middle income countries, so definitely when a family is affected by such an incident, their bread earner gets hit or has an accident. So the burden of economic stress comes directly to his family in shape of numerous factors. So these are significant challenges, and definitely, and the burden which enhances upon the health systems again, it's enormous. We have around 50% out-of-pocket expenditure, mostly 60%, 70% of our population going to private sector. So that is a critical challenge for us as well. Road traffic accidents, agriculture-related incidents, especially amongst youngest people, so they are contributing significantly to our issue. And then, so what Pakistan has been doing, so apart from supporting and moving ahead with this TBI resolution and engaging other member states to build up the momentum in order to reach the resolution during the next general assembly. So apart from that, at the country level, trying to strengthen the emergency services, and along with that, legal framework is being put in place to get the data from the private sector, so that we have a whole spectrum of data with us, and based on that we are able to plan our future plans based on evidence. So apart from these two challenges, the government is also supporting the people who are below poverty line. There is a social protection or network of initiative by the government which provides funding to the poor, so that they are able to take care of their other NCDs application, which includes injuries as well. So this is an important area which the government is trying to fulfill its obligations. Within our new National Health and Population Policy, emergency services and injuries, they have come up strongly. Though we are facing NCDs, communicable disease and maternal and child health issues, but based on our data and expected challenges, so the government of Pakistan is now included as a policy priority within its next 10 years policy document. So that would help further acquire domestic financing, and then we can have technical assistance from partners to strengthen our emergency services, so that we are able to better provide our emergency services and rehab services. It's a bit we are deficient with that, and though significant bit of work has been done since long, because we are facing earthquakes and floods and all those challenges are there. So, but still, the rehab services, they are not that strong that we are able to cater for our larger individuals who are being affected. So these are the focus areas and what we are doing, but definitely it would require a continuous effort. Thank you very much.
Mr. Chairman, dear participants and dignitaries, good evening. First of all, thank you for inviting me to this great meeting, this stunning city of Geneva. My name is Dr. Johannes Lambolong Lukumai, the chairperson of Parliamentary Standing Committee on Health and HIV issues in the United Republic of Tanzania. Let me start by saying that I'm here because of Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, who hosted and became the guest of honor the last second international conference on neurosurgery held in Dar es Salaam. And that's why I'm here. Chairman, you see, traumatic brain injury is an issue. It's an alarming issue. You see, in Tanzania, about 73% of patients suffering from traumatic brain injury are young people aged between 15 years to 45 years. These are our students, these are our workers, this is our future. Most of the mortality goes up to 60%. Not simply because of injuries, but because of delays due to poor infrastructure from the periphery to the centers or to the hospitals where they can get treatment. So we are facing this kind of infrastructure. But thanks to our President, Dr. Samia Suluhu Hassan, because since she took office, she's really invested in accelerated major development projects, majoring on infrastructure development, capacity building, public-private partnership, and reforms and stability. And more importantly, initiated universal health for all, whereby these people who are poor can access services. The government will subsidize the services. And she went on to invest a lot in equipment like MRI to these major hospitals all across the country. We have quite a number of RMIs and CT scans. And not only that, but also training for neurosurgeons and the development of guidelines for training, and also trying to partnering with other organizations or other institutions. So, Chairman, I can say that in Tanzania, we are happy to be here and we support, because of our experience proved that traumatic brain injury is a major problem, and we look forward to work with partners in WHO to make this a reality. Thank you.
I think that takes up the time. I'd just like to thank all our ministers. I think what's been really positive is that we've often focused very much on acute care, but the goalposts have changed, and it's really positive that we're hearing about prevention, we're hearing about imaging, and particularly we're beginning to hear about rehabilitation, and that is so essential, and the goal of getting these patients back reintegrated to their families and into the community. I'm just going to hand over to Tony to make a few closing remarks. But again, thank you to all the ministers and thank you to everybody for being here. Tony.
So just to say, once again, we got through one of 4 questions that we had, and it's a reflection of the fact that there's so much to say about the subject. There's so many different stakeholders, all of whom have a slightly different perspective, but every perspective that we need if we're really going to make the dent in the problem that we'd hope. So just as a last to thank our excellencies, our ministers and representing their member states. We thank them for their time. We hope that we have sold them on the importance of the condition. We hope that we put some fire in them, and we hope that they will take this message back to their respective governments and will amplify the work that everyone in this crowd is already doing. So if you would just join me in another round of applause, thanking them for
If the ministers are happy to stay till the end of the next panel, then we can have a group photograph with all the ministers, if that's okay, if you can just bear with us. So thank you so much. So could I invite our next moderators up to the stage? That will be Hugh Park, who is the new president of the International Society for Global Neurosurgery, and Tariq Khan. And Tariq, you've been a real driver of this initiative, so again, thank you for everything you've done.
Thanks, Haj. So, for the next panel, I would like to request the Executive Director of the National Public Health Institute, South Sudan, Dr. Chung. Acting Regional Emergency Director, WHO EMRO, Dr. Annette Hanselman. Her Excellency, Advisor to the Prime Minister for Public Health Affairs and former Minister of Health, State of Qatar, Dr. Hanan Al-Khwani. So thank you very much, everybody. So there's been a lot of discussion on the need for prevention, the need for acute care, the need for rehab. And I think we need to start and discuss, and we've seen there's a lot of support from the civil society. And of course, we feel that many of the countries are supportive of this initiative, making traumatic brain injury as a notifiable chronic condition. Now the question is, how do we move forward in this manner so that we are able to go to a resolution through the Executive Board and then up to the World Health Assembly in WHA 80. So I will start with you, Dr. Shah.
Yeah, thank you, Prof. And as you have heard, my name is Dr. Chong. I am the Executive Director for the National Public Health Institute, South Sudan. I here represent my minister who was supposed to be here, but is now caught up with another high-level ministerial meeting on the global health architecture reforms. Once again, I want also to express my appreciation to the previous panelists, and especially the last one that was really sharing the country's perspectives. South Sudan, as many of you might remember, is generally known as the youngest country. We are not only young because of years of independence. Our country has around 80% of the population are around the age of 35. And we all know globally the traumatic brain injuries are actually more common and becoming the leading cause of death among the young people that are less than 40 years. And we also know that the low middle income countries, of which South Sudan is one of them, are carrying the biggest burden, over 90%. I would want to say specifically within South Sudan, it's a country that has all the factors. It's new. It's a country that is known emerging from conflict and is still in conflict. Fragile health system. Some speakers mentioned that, and that the TBI is more common with fragility. We also have the poor road infrastructure in the country, and that, in our context, the leading cause of traumatic brain injury is the road traffic accidents, plus the conflict itself, domestic violence, and many other factors that are there. For us here today, we are extremely excited to be part of this initiative. And South Sudan does not only support, South Sudan sits on the EB, or the executive board of the Global Fund. I mean of the World Health Organization. Sorry, I have been actually a member in the Global Fund initiative for long. So we are also excited to be together in this event with the members and the director of our former region. South Sudan was part of Sudan. We are part of EMRO. So having this initiative and coming back to be part of this is a greater, initiative for us. And I am actually authorized by my minister to not only declare our support, but to announce that South Sudan will be in a position to co-host this call and this initiative, to have it in the next assembly.
Okay, thank you very much. We have heard that with 69 million brain injuries per year, that we are facing here a major and universal burden of disease and a major public health problem. For us in the Eastern Mediterranean region, we have 9 out of 22 countries which are affected by fragility, by conflict, by violence. And the emergency health systems are overstretched and overburdened across the entire trauma pathway, from the community, along the referral system, the emergency rooms, the admission and the rehabilitation system. Yet, as you just said, conflict and violence is not the only reason. A major issue are the road traffic accidents, which are disproportionately affecting young people in the productive age. So it is not only a health problem, but it is also, and especially in the low and middle income countries, where, as we already heard, a high burden of traumatic brain injury occurs. So it's not only a health problem, but it is also a workforce and a socio-economic problem, not only for the patients, but also for the families, which were very often depending on this productivity of the young people. And as we heard, we have long-term sequelae, cognitive mental health and also social ones, yet traumatic brain injury is underreported and under-prioritized. So the question, how can we work together, I think, or towards the next, or the recognition at the next World Health Assembly, is really insisting collectively on the necessity to invest in systems, to invest in road safety, in safer infrastructure, in stronger emergency care systems and stronger rehabilitative systems. So from our side, we are really calling for member states to support a possible resolution, because this would really accelerate national action, giving the public health issue visibility, increasing surveillance systems, and accelerate investment into health system and trauma and emergency care system, based on the resolution 76.2, but also based on other already existing initiatives like the trauma initiative. And I think the most important thing is also it's about dignity of a big population and their families affected by the chronic condition caused by traumatic brain injury. And we are accountable for these, to these people to find solutions for their chronic problems. Many thanks.
Thank you very much. For starters, I would really like to say that I appreciate being here with you today. When I received this invitation, it was a no-brainer for me to accept immediately. The distinguished panels we've had and the level and the quality of the conversations we've had around this topic, this was shared by many. The same passion was shared by many around the table here today. Traumatic brain injury, or trauma as a theme and emergency as a theme, has been strong to my heart for many years. And so traumatic brain injury in Qatar is well documented. It's a significant clinical and social burden, and one that our country has chosen to confront with deliberate investment rather than a passive management. And what Qatar has demonstrated is that as a country, in our region, we can choose to treat trauma, and specifically traumatic brain injury, as a solvable problem rather than an inevitable consequence of development. The combination of political will, of cross-sectorial prevention investment, and of health system excellences has produced a trajectory that is documented, it's reproducible, and increasingly recognized by WHO and others. And we are proud of that record, but we are also committed to using the platform of being a WHO-accredited collaborating center to ensure that this work extends beyond our borders and to every country in the region and beyond, where trauma continues to claim preventable lives. And with regard to your question, and by the way, there I have a lot of stories to tell, and I can give you the development of our system, but because we are running short of time, I'll answer straight away your question. But anyone who would love to have a conversation with me, I am truly passionate about trauma and emergency. And with regard to what, first, this resolution is definitely needed, and it's an important resolution. I do not believe there's any documented, clear documentation of traumatic brain injuries. Like our country, like others, we record this data via other sources, through trauma registries and others, but there is not a single documented source for traumatic brain injuries. And as you heard from our panelists, these are injuries that mostly burden our youth, and they have long-term consequences. And they are injuries that require a system approach. So from pre-hospital, prevention, quality acute care, and then rehabilitation and community care. So this requires a comprehensive approach, and I believe that there is enough will around the table here. And as our colleague said from Tanzania, that you will be taking South Sudan. We had our colleague from Tanzania already. You will be taking this forward as a member of the executive board, which is excellent, and I'm sure that there'll be a lot of support for this. However, just some general advice. Evidence. We need to have evidence and data as much as possible to present that. Second, this is a multi-sectorial problem and needs to have a multi-sectorial solution. And therefore, the recommendations need to encompass a multi-sectorial approach as much as possible. Third, the political will and the political support, and you have that. You have a very large, distinguished number of ministers around the table. I've been to many events and we don't have this many ministers around the table. And then, of course, you have the opportunity with traumatic brain injuries of addressing multiple topics because it approaches different elements of the health system. And also, I would be remiss coming from the Middle East region not to mention conflict and the importance of conflict, because traumatic brain injuries is a preventable condition, and it is something that by focusing on prevention, we would be better positioned in terms of biggest gains. And therefore, I would recommend that within this approach, we also focus on ensuring that the causes or the main elements that cause mass prevention or mass traumatic injuries are addressed, such as road traffic accidents, conflicts, and injuries. So thank you very much.
So we know now what TBI is. We know why we need to put TBI on the global health agenda. And now we're going to turn to how. So think about very specific recommendations, including deadlines and timelines and who needs to do what. We'll come to you. But before I do that, I've been in conversations with Minister Bernoya from Guatemala. I know you are deliberating on what role Guatemala will have in supporting this resolution. Have you reached any conclusion yet?
No pressure?
No pressure. So deliberating.
No, it's, I think, political support and political will has been mentioned several times over the meeting, and yes, definitely, we would be happy to co-sponsor that.
Yes!
No pressure.
Minister Luke Thompson is here. Yes. Please come, join us. Yeah? Okay, up to you. This is almost emotional for me. Thank you, thank you. So the question is, let's be very specific. We have a year, but it's not exactly true, right? We'll go through one by one. Role of the member state in NEB. What needs to happen next? How do we drive political will? How do we get that consensus that we need to get this to its success in May, WHA 80, May of next year? We'll start with Your Excellency.
Thank you very much. I think you started really well. So hosting this event is an excellent idea, and continuing to engage with the ministries and the professionals and the associations are really important. I think also the sort of sharing experience is important. Sharing in sort of developing the proposal, the more we can share experiences as to what works in different settings and different systems, that would be wonderful. So as we heard, we come from different regions, and the regions have different needs, different capacities, and they all need different levels of investment to advance traumatic brain injury. So thinking a little bit through what type of investments are needed in the different contexts and the different settings, that would also be very helpful in bringing forward in the conversation. You do not have to have figures per se, but just showing that you understand the different levels of investments. That would be wonderful. I think that you've already worked with the ministers. Continue to do that in order to present at the executive board, and you're having very good conversations and very successful conversations with regional coordinators and others. I think that's going to help you with reaching that. I'm sure that you're going to reach it, so you don't have to worry, but you need to work towards it.
So be very specific on your recommendations. We have civil society here, from everyone from academia to NGOs. We even are now going to have a global coalition, youth coalition for TBI. So we have a range of ages as well. So be very specific on your recommendations, who does what. So thank you.
Thank you. Yeah, it's very much, I mean, we come from the same region, Dr. Hanan, so it is very much in the same lines, because we have already, following also regional committee decisions, we have already in our region a trauma group, which a trauma initiative, which is really very much invested in the entire traumatic brain injury initiative we are talking about. As Dr. Hanan said, or Dr. Hanan Balfi said, the entire initiative to recognize traumatic brain injury as chronic condition was also inside WHO very much triggered by our region. So with regards what to do, very much what Dr. Hanans just said, it is consultation with the civil society. I think the academia is also very important. And then what we plan for the coming years is also engagement and to foster the engagement among member states with regards to the topic, and to bring forward that by next year there is a consensus hopefully reached. Thank you.
Yeah, thank you once again. I'm happy to see my minister join us. Honorable Minister, very much welcome. There are a few things I just want to emphasize on what we can do and what we're supposed to do. As we generally say, the problem is mostly faced by middle-income countries, and it's affecting mostly the young population, the youth, and that actually applies to us. Honorable Minister, I've indicated that earlier. It was mentioned earlier by some of the panelists that it's a multi-sectorial issue. It's not a health issue. And in our context, we always engage and we do complain when the other sectors are having limitations. The biggest burden comes on health. And I was mentioning this morning when we have, as we said, the leading cause of the TBI is the road traffic accidents. And in our country, we have poor road infrastructure. Unfortunately, when there are victims of the road traffic accidents, they are not taken to the ministries of road. They are brought to the hospitals. And we take responsibility that we have less contribution to. We have issues of limited capacities, the diagnostic capacities in the country, and we know how timely, transportation of the victims and the diagnostic equipments are critical for handling the TBIs. We also know that the surgical capacities in the countries, in the middle-income countries, and in particular countries like South Sudan, are very much limited. We also know that the political will, I'm happy that my minister is here, and we have already mentioned earlier, the declaration and the commitment on behalf of the minister. South Sudan being a member of the executive board of the World Health Organization, will try to do whatever we can do within that body to push for this agenda. We also know one important thing that we want to emphasize here, the TBIs, although we say it's multi-sectoral, is a public responsibility. It's a general responsibility of everyone. In our context, and we mentioned road traffic accidents, not only poor road infrastructure, there are also poor road safety regulations. And if regulations are there, they need to be enforced, and that has to come from other sectors. We also need to increase the public awareness. We come from a background where we are not obligated to use the seat belt. And in some contexts, when we are reminded about the seat belt, we say, it's okay. And you never know. Something can happen just in the blink of an eye, and you get, the consequence we are talking about here. So a lot of awareness is required, and involvement of all the other sectors, and more importantly, the education. In terms of messages that should be included in the school health program, in how we can actually sensitize the population and the young people, it requires a collaboration of all the sectors. I would want to repeat again, with the support of my minister, the political will is there, we will do what we can do as much as we are available for the EB for the next World Health Assembly. Thank you.
So, excellent discussion. Thank you very much, panelists. Really, this has been an amazing event, much beyond our thinking. This coalition started 2 years back. We were initially just us, Northwest School of Medicine, and Cambridge University, Peter Hutchinson, and now we have more than 50 international organizations of all types supporting us. And then each organization, like G4 Alliance, has got more than 80 organizations with them. So it's a huge number of civil society and different organizations, from rehab, from acute care, from anesthetists, from NGOs, from everybody. And now we have so many ministers and advisors supporting this resolution. And thank you to the Ministry of Pakistan, Government of Pakistan, for moving the resolution. And I must tell you that the Ministry of Indonesia and the Ministry of Turkey have also agreed to co-sponsor the resolution. Unfortunately, they could not be here. We have got Qatar, we have got RD, regional director, we have got South Sudan, Guatemala, and we've got Tanzania, Cambodia, and so many others. Really, so I believe that now we have to look at the deadlines, because September is the deadline to put in the resolution once again to the EB Executive Board. We've also spoken to the Australian government, and they are supportive as well. We'll be talking to them further on that. And then, of course, there's a pre-board meeting in November. We've learned all this along, but we later on found it was all documented. But we novices, we didn't know, so we were slowly getting it. And then we know that, of course, January is the decision point whether they would put the resolution to the World Health Assembly or not. So we are, of course, banking on our ministers and advisors, because we can only try and get the stuff together, but I think it will be you people who will be really pushing this resolution. We are with you, and you will be moving forward, and we will be behind you. Thank you so very much.